Okay, hello. So I have just washed my hands and now I'm getting ready to assess my patients. Hello, my name is Samantha. I am your student nurse practitioner today.
How you doing?
Good, how are you?
Pretty good.
Good. Okay, so the first thing I'm going to do is inspect his skin. So his skin looks good. I don't see any nevi, any rashes, no masses of any sort. Temperature is warm bilaterally. Okay, let's see your fingers here. So fingers, there is no clubbing. They are pink. His nail beds are pink, and the capillary refill is less than 3 seconds on his left. On his right hand, again, capillary refill is less than 3 seconds. Thank you. So his head is normocephalic. It is symmetrical. I don't see any trauma. I'm going to take a look at his scalp. So scalp looks good. Hair is normally distributed. No evidence of any malpattern baldness. I'm going to assess your temporal arteries. Pulses are palpable, and then your carotid. Pulses are palpable bilaterally, and now I will auscultate. Very good. I don't hear any bruise. I'm going to check here for TMJ, so if you can, open and close your mouth. Okay, very good. So the jawline feels very good, and there's no clicking. Okay, I'm going to take a look at your eyes. So looking into his sclera, sclera is white, conjunctiva looks clear. I don't see any cloudiness or opacities over his lens. I'm going to open look at here. That's very good. Okay. Conjunctiva looks good both in the upper and lower lids. Okay. And now I'm going to ask you to follow my finger. Okay. Okay. And good. So cranial nerves 3, 4, and 6 are intact, and he has very good accommodation. Okay, so next thing I'm going to do is check your pupils. So I'm just going to take a look. You can just look straight. Pupils are about a 5 millimeters. And I'm just going to, if you look straight ahead for me. Okay. So pupil constriction is directly seen in his left eye when I shine a light into his left eye, and also consensually constricts in his right eye as I shine a light in his left eye. And in the right eye, same thing, you have direct constriction as well as consensual constriction. Pupils are round and equal. Very good. Okay, so the next thing I'm going to do is I'm going to check, do a fundoscopic exam. So I'm going to dim the lights. Okay, very good. And I'm just going to ask you to look straight ahead for me. So when I take my fundoscope, I'm going to make sure that it's on 0 because I have normal vision. I'm going to come in from my right onto your right. Once I find the red reflex, I'm going to come in. And I can see the optic disc is a creamy yellow. The optic nerves are converging inward. And a little bit to the side of it, the macula is seen in a darkened color. Okay, come to the next side, take it on my left hand, come in once I find my red reflex, come into your left, and I see the same thing on this side, and there's no papilledema around the optic disc, meaning no swelling around there, and I don't see any hemorrhage. Okay. Very good. Now I'm going to assess your ears. So checking the lobes and the auricle and the tragus, and there's no swelling, no redness, any tenderness. Okay. And the next side, same thing. Okay, very good. And then as I take the fundoscope, I'm going to look straight in. And the tympanic membrane appears pearly gray. It is shiny and translucent. There is the cone of light at 7 o'clock. And I see the hammer of the malleus. No bulging or no redness. And there's also no wax. Check the other side. Okay. Same thing. Everything looks good and clear. Again, no redness, bulging, or perforation of the tympanic membrane. Okay. So, I'm now going to inspect your nose. So I'm going to check for nasal patency. So the first thing I'm going to ask you to do is plug each side of your nose and breathe in. Very good. And the other side. Very good. So nares are patent bilaterally. Take my fundoscope. I'm going to look up into your nostril. And I see that the septum is not deviated. There's no perforation. I don't see any polyps. And no excessive drainage. The turbinates are pink. Check the other side. Same thing on the other side. Very good. I'm just going to palpate your sinuses and you let me know if there's any tenderness. Okay? So maxillary. Yeah. And frontal. Okay, very good. Now I'm going to check your mouth. So your lips are symmetrical. They're pink and they don't look excessively dry. Can you smile for me? Okay, teeth are good. Okay, and I'm going to check out your tongue using my gloves. Okay, can you stick out your tongue for me? Okay. Very good. Very good. Good. So I don't see any lesions or any patches of white on his tongue. Oral mucosa is pink. And now I'm going to assess the back of your throat. All right, so if you could, just open your tongue, open your mouth and say ah, and stick out your tongue. Ah. Very good. So the oropharynx is pink. There's no redness, no exudates. Tonsils are normal size, and the uvula rises midline with the soft palate. Very good. Okay. So I am going to now assess your range of motion in your neck. So if you could, look side to side. Very good. Up and down. Very good. Okay. And then if you could push your head against my hand. Very good. And the other way. Very good. Okay. I'm going to take a look at your neck. Trachea looks midline. The thyroid gland does not look enlarged. I'm going to check your thyroid gland from back here. So I feel the isthmus. Could you swallow for me, please? Very good. So the thyroid gland rises when he swallows. It does not feel enlarged. Just going to check your trachea. Trachea feels midline, is not deviated at all. Okay. Now I'm going to check your lymph nodes. So we have preauricular, posterior auricular, occipital, tonsillar, submandibular, segmental, superficial cervical, deep cervical chain, posterior cervical, and supraclavicular. And I do not appreciate any of the lymph nodes at all. Okay, so now I'm going to take a listen to your heart. Okay. So you can relax here. I'm just going to listen. The first area here is his aortic area, pulmonic, tricuspid, and mitral. Very good. And I'm going to listen with the bell as well. So aortic, pulmonic, tricuspid, mitral. And I'm going to go back and listen to Erb's point, which is just below the pulmonic area. Okay. I hear S1, S2 in all of the areas. I do not hear any murmurs. I don't hear S3 or S4 heart sounds. So very good. Okay. Next thing I'm going to do is just look at your chest, and I don't see any abnormalities. So I'm going to take a listen. Deep breath. Very good. So breath sounds are clear throughout bilaterally. There is no crackles, no wheezing, no rhonchi, and there's no areas where his lung sounds are diminished at all. So very good. Next thing I'm going to do is test for tactile phragmatus. I'm going to use the ulnar side of my hands. So I'm just going to ask you to say 99 for me.
99, 99, 99, 99, 99, 99.
Very good. So I feel vibrations equally bilaterally in all the lobes, which is very good. No consolidation there. Very good. And then I'm just going to percuss. Okay, very good. Lung sounds are resonant bilaterally in all lobes. Okay, and finally I'm going to ask you to lay down for me. Okay. Going to up higher a little bit. Very good. Thank you. Okay. First thing I'm going to assess for is jugular venous distension. So if you can look to that side for me. Very good. So with patient at a 45-degree angle, I cannot see any venous distension at all, which is very good. And then I'm going to feel for the point of maximal intensity. So the point of maximal intensity is in the fifth intercostal space, and it is 10 centimeters away from the sternum. Very good. I'm going to assess for heaves or thrills. So I'm just going to palpate here. No heaves or thrills. And I'm going to feel your pulses. Very good. Okay. Radial and brachial pulses are 2+ bilaterally. I'm going to check your popliteal pulses. Okay. Popliteal pulses are 2+ bilaterally as well. And pedal pulses. I don't think the camera can see me. Okay. Good. So pedal pulses and posterior tibial pulses are 2+ bilaterally as well, and there is no edema noted at all. Very good. That is it. Thank you, sir.
Thank you.